So for our next topic will be on the under din ng micronutrients sa ating mga minerals. So when we talk about the minerals, these are micronutrients. So like the vitamins, only small amount are needed to accomplish the great deal. So ang kailangan natin dito pag sinabi na micronutrients, our body need in smaller amount. Minerals do not contain calories. Unlike sa mga vitamins, they aren't destroyed by heat. So cooking doesn't affect the content. When food is burned down to ash, the ash remaining is the food's mineral content. Okay, so multitasking minerals natin. Minerals are part of the cells in the body, including sa mga red blood cells, okay, bones, teeth, nails, and sa mga muscle structure. Okay, minerals regulate chemical reactions in the body, including yung maintaining levels inside and also outside the cells, keeping a regular heartbeat, helping nerves respond normally, okay, and allowing blood clotting in wounds and regular or regulating the release of energy from the food. And we have also different types of minerals, the major and the okay, we have the major and then the trace minerals. Okay, for our major minerals, we have the calcium, phosphorus, potassium, magnesium, sodium, chlorine, and sulfur, which is needed in larger quantities. Okay, mas kailangan mo ng mas madaming major minerals kesa sa trace minerals. Wherein sa trace minerals natin, which we need as mas small amount, we have the iron, okay, iodine, fluoride, zinc, manganese, chromium, molybdenum, copper, selenium, and yun, yung ating mga trace minerals na mas maliit dapat ang kailangan kesa sa major minerals natin. So, ano yung functions ng ating minerals? Okay, general to, which is the body building, okay, like sa teeth and sa mga bones natin. Kapag sa teeth naman, we have, di ba, yung mga calcium, phosphorus, and or phosphate. Okay? Yun yung sa teeth and sa bones natin. Okay, another function nila is to control of the body processes, especially the nervous system. Okay, like yung ating mga electrolytes or minerals na magnesium and calcium, which can modulate the transmission of the nervous stimuli. Another function nila is essential part of body fluids and cells. We have yung ating sodium, potassium, and chlorine, okay, or chloride. And yung form part of enzymes and other proteins necessary for the release of energy. You like yung mga iron natin and then yung mga magnesium, which is under ng ating trace and major din. So, yun yung general functions ng ating minerals. So, unahin muna natin sa ating major minerals. Okay, we have the number 1 here is the calcium. Okay, sa calcium natin, this is, ang distribution ng calcium is one of the total body weight natin approximately, nasa 1.5 to 2.2% is calcium. 99% of this is present mostly saan? Sa bones, sa teeth, and remaining 1% is present in the soft tissue and body fluids. So, doon nakikita or saan natin matatagpuan ang mga calcium natin, which is major minerals. Okay, ano ang function niya? Okay, calcium combines with the phosphorus to form calcium phosphate. Okay, the hard materials of bones and teeth. Okay, another one is blood clotting. Blood clotting factor. Tumutulong sa ating calcium because calcium ions play a major role in the tight regulation of the coagulation cascade. When we talk about coagulation, ito yung process of becoming viscous or lumalapot or tumitiken, okay, or nagtitiken into a coherent mass to prevent the bleeding or yung pagdurugo. Okay? Participates also in muscular contraction and relaxation. Okay? So, kasali din si calcium natin sa muscle contraction and relaxation. It also promotes for blood circulation, which helps the blood vessels to relax, constrict, which tumutulong siya para sa blood circulation. So, saan naman ang sources natin for the calcium. We have the dairy products, yung mga milk products natin. Okay, fortified white bread, oily fish, green vegetable, nuts and seeds. Okay, citrus foods. And yun yung mga sources natin for the calcium. Effects of deficiency or excess. Anong ginagawa niya kapag sobra or kulang ang intake natin for calcium? Okay, we have the stunted growth can cause, okay, rickets. Dito, sa rickets natin, okay, this is a disease of children caused by vitamin D deficiency. Okay, characterized by imperfect calcification, softening, and also distortion ng mga bones. Okay, so another one is the osteomalacia. Osteomalacia, this is the softening of the bones, nanlalambot. Okay, because our body needs calcium to maintain the strength and hardness of the bones. So kapag kakulang ka, okay, anong nangyayari? Osteomalacia. Okay, another one, hypercalcemia, kapag nasobrahan naman din. Okay, high calcium level in the blood. Okay, too much calcium in the blood can weaken your bones, creating kidney stones. Okay, possible na makakaroon ka ng mga bato-bato, and interfere with how heart and brain work. So, yun yung mga nangyayari kapag ka nasobrahan or nakulangan ka ng calcium. Okay? So, yung sa rickets kasi natin, either deficient or increase intake ka. Sa osteomalacia, decrease ang intake ng mineral which is the calcium, and then kapag hypercalcemia na sobrahan, okay, excess of calcium. Okay, we also have the next major mineral. Okay, we have the phosphorus. Okay, for the phosphorus, ang distribution naman nito is normal human body contains about 1% of phosphorus, which is 12 gram per kilogram fat-free body weight. About 85% is in the inorganic phase of bones and teeth in combination with the calcium. Okay, so yun yung distribution ng ating phosphorus. Okay, ano naman yung function ng ating phosphorus? Okay, so there are components of bones and teeth with calcium. Kasama po si ating phosphorus. Component din of every cell and muscle contraction. Okay, tumutulong for muscle contraction. Because phosphorus works with the B vitamins in helping for the muscle contraction. Okay, kakombine niya si B vitamins natin. And yung mga sources natin for the phosphorus, we have milk and milk products, which are the best sources of calcium also. And dairy products offer protein, vitamin D, and phosphorus. Okay, individuals with milk allergies or those on special vegetarian diets can get calcium from fortified soy milk, okay, firm tofu, fish with edible bones, and fortified foods. Okay, ano naman yung risk groups of calcium deficiency? Okay, since calcium is such a crucial part of the balanced diet, okay, there are several groups at risk for calcium deficiency. Okay, we have the children, which is calcium deficiency can interfere with their growth and affect the bone density and bone loss. Sa women naman, girls or postmenopausal women, pag sinabing postmenopausal, okay, kakatapos or hindi na siya nagme-mens, okay, may limit their dairy intake because of fears of weight gain from the calories and fat na iniinom nila. Okay? Another one, sa mga strict vegetarians, kaya they are risk for calcium deficiency itong mga to. Okay, strict vegetarians, calcium levels can be maintained with careful dietary planning. Okay, nalilimitahan yung ini-intake nila. Another one dito is lactose intolerant. Okay, for the lactose intolerant, this is limit their dairy intake. So calcium level should be evaluated. Ibig sabihin, hindi nila kayang ma-absorb or ma-digest si lactose, so they are limiting themselves, kaya sila under ng risk group for calcium deficiency. Okay, another one, after the calcium and phosphorus, we also have the potassium. Okay, yung potassium natin, ang distribution ng ating potassium is potassium is a principal cation present within the cells, di ba, inside the cells, or in the intracellular fluid, okay, fluid contained within the cell. Pag sinabi yung intracellular, okay, about 2.6 gram per kilogram fat-free weight is potassium, which is ang sa body weight natin, ang composition niya is 0.35% yung ating potassium. So, anong function ng ating potassium? It maintains the fluid and electrolyte balance. Aside from that, play a significant role in the activity of skeletal and cardiac muscle. Okay, so anong ginagawa niya sa ating skeletal and cardiac muscle? So, we need the potassium to keep the electrochemical balance across our cell membranes. This is very vital. Pag sinabi natin vital, important, or necessary para matransmit yung mga nerve signals. Okay, this leads to skeletal muscle contraction, hormone release, and smooth muscle, and also yung ating heart contraction. So, meron siyang mabigat na trabaho or kailangan siya ng ating or may specific role siya sa activity ng skeletal and cardiac muscle natin. Okay? It is also important in the carbohydrate and protein metabolism. So, we also have sources ng ating potassium. Okay, we have the meat, legumes, milk, okay? Ano pa? Raw and dried fruits, fruit juice, dark green leafy, and unrefined cereals. Sa ating unrefined cereals, these are in their natural state, okay, have not undergone any processing, and all natural nutrients are still intact pag sinabi nating unrefined cereals. Okay? So, yun yung mga sources natin for the potassium. Okay? Pag sinabi naman natin deficiency of potassium, ibig sabihin, kulang ang intake mo ng potassium. So, anong mangyayari dyan? Anong mangyayari sa blood volume mo ng potassium? Okay, babagsak, which is the hypokalemia. Low serum potassium. Okay, mababa ang potassium level mo sa dugo, which result from prolonged wasting disease. Okay? Pag sinabi nating prolonged wasting disease, diseases that causes a person to gradually become very thin and very weak. Weak wasting, parang pumapayat ka. Okay? Aside from pumapayat ka, nanghihina ka pa. Okay? Kapag nasobrahan naman, okay, that is hyperkalemia, high serum potassium, which occurs when the kidney fails to excrete potassium properly. Kapag may problem ang kanilang kidney na hindi nilalabas ang potassium, so anong nangyari? Naiipon si ating potassium. Okay? Another one is apathy. This is yung lack of interest. Wala siyang pakialam. Concern or attitude of not caring. Wala siyang pakialam. Okay? Another one is muscular weakness. Okay? Nangihina. Another one is our mental confusion or what we call the delirium. Okay? Ito yung nag-change yung person's awareness. Okay? Nagkakaroon siya ng confusion. Another one is abdominal distension, which is abnormally swollen outward. Ibig sabihin, yung tiyan niya pa lumalaki, okay, or pa-protrude outward. Okay, abnormally swollen outward. Okay, yun yung distended ang kanilang abdomen part. Aside from our potassium, we also have the minerals which is, or the major minerals which is the magnesium. Yung ating magnesium, okay, dinedistribute naman siya. Okay, about 50% of the magnesium in the body, okay, is present in the bones in combination with the phosphate and also sa calcium natin. The remaining almost entirely inside the body cells with only about 1% in sa extracellular fluid. So, outside the cell natin, yung ating magnesium. Okay, we also have functions ng ating magnesium. Okay, for the function, it regulate diverse biochemical reactions in the body, including protein synthesis. Pag sinabi natin protein synthesis, okay, important in making the protein. Okay, muscle and the nerve function. Okay, tumutulong si ating magnesium para ma-maintain, it helps to maintain yung ating muscle and nerve function. Another one is blood glucose control. Okay, bakit siya nakakatulong for the blood glucose control? Because increase in magnesium intake shown to improve the glucose metabolism sa mga diabetic patients and nai-stabilize niya yung insulin level. Okay, kaya isang function nito is nakokontrol nyo ang blood sugar. Okay? Another one or the blood glucose. And also, ang isang function niya is for blood pressure regulation. Okay, anong ginagawa niya naman sa blood pressure natin? It acts as a natural calcium channel blocker and induces the direct and indirect vasodilation. So, prevent niya ang pagtaas ng blood pressure. Okay, another function niya is required for energy production and oxidative phosphorylation. Okay, itong oxidative phosphorylation natin, this is a metabolic pathway in which cells use energy to oxidize the nutrients. Okay, and also the glycolysis. Yung glycolysis naman natin is a series of reactions that extract the energy from the glucose by splitting into the three carbon molecules. Ibig sabihin, pinaghihiwalay-hiwalay niya. Okay, para makuha niya yung, okay, para ma-extract niya yung energy na nakukuha natin for the glucose. And another function niya is play a role in the active transport of calcium and the potassium. So we also have sources ng ating magnesium. Okay. Ang ating magnesium, we have sources, we have the nuts, soybeans, meat, milk, cacao, seafoods, whole grains, okay? Okay, peas and also green plants. Yun yung mga sources natin for the magnesium. Okay, we also have deficiency of magnesium. Pagkakulang ang intake mo ng magnesium, ano mangyari? Hypomagnesium tetany. Okay? This has been observed among the infants and children suffering from kwashiorkor and diseases characterized by intestinal malabsorption, prolonged diarrhea, aside from that, yung mga nagsusuka, vomiting, and alcoholism. Okay, because yung alcoholism natin is alcohol acutely as a magnesium diuretic. Okay, kapag ka-alcoholic ka, ibig sabihin, nailalabas mo si magnesium through urine. Kaya nagkakaroon ng hypomagnesium tetany. Okay, yun yung deficiency natin kapag bababaan na ang magnesium level natin. So aside from the magnesium, we also have another major mineral which is the sodium. Okay, yung sodium natin, okay, also known as the sodium chloride or the NaCl. It is also another important mineral ng ating katawan. Both sodium and potassium are electrolytes, meaning they transmit electrical currents in the body. Okay, some sodium comes from table salt. Okay, for the distribution naman ng ating sodium, sodium is monovalent cation, 50% of which is found sa mga extra cellular fluid, okay, which is fluid outside the cell, like yung mga blood, lymph, or other tissues. And 10% is found in the cell, and the remaining 40% of the body sodium is found sa mga skeleton. Okay, so yung function ng ating sodium, okay, for the function, responsible for maintaining the fluid balance, same with the potassium natin. Responsible for maintaining, okay, yung ating responsible for the maintaining of acid-base balance. Okay, so yung ating una, responsible for maintaining the fluid balance, ito yung ating osmolarity, which is when the sodium is retained, okay, less urine is produced, eventually causing the blood volume to increase. And then, yung itong dalawang to, na responsible ng ating sodium, same with the potassium natin, which helps the body function normally by maintaining fluid and blood volume. Parehas sila ni ating potassium. Okay, another one, allows the passage of materials like the glucose through the cells. Okay? Ito yung sodium-glucose co-transporter activity, and also it maintains the normal muscle irritability and excitability because yung ating sodium, it helps to regulate the nerve functions and muscle contraction. So, yun yung ating mga functions ng sodium. Okay, saan naman natin nakikita or sources natin for the sodium? We have the carrots, celery, beets, soy sauce, ketchup, spinach, peas, vetchin, fish sauce, or yung patis, processed foods, and then yung mga canned goods. Yan yung mga matataas na sources natin for sodium kasi nga gamitan siya ng mga preservatives. Okay? High in sodium content. So, we have also tips for lowering the sodium intake. Ano yung mga gagawin natin para malimit natin or mababaan natin yung mga pag-intake natin ng sodium. Okay, read the food label to check the sodium content of the processed foods, especially yung mga frozen diners, packaged mixes, soup, salad dressing, and yung mga sauce. Okay, another one is salt content varies greatly between manufacturer and processing method. We have to choose fresh aside sa mga dati nang nakapack or naka-preserve. Okay, aside from fresh, frozen, okay, or low sodium canned vegetables rather than the regular canned vegetables. Another tips for lowering the sodium intake is rinse the canned vegetables kapag yung canned ang gagamitin. Okay, hugasan to reduce the sodium content by 23 to 45%. Okay, note some B vitamins will also be lost kapag nagkakaroon or winawash yung certain na product. Okay, choose fresh or frozen meat, okay? Poultry and seafood rather than canned. Cured, kapag sabing cured na preserve siya ng asin, okay, or smoked meats. Okay, so another tip is limit salty condiments like yung mga soy sauce, mustard, pickles. And also replace the salt with spices. Pag gusto mo ng may lasa, palitan mo siya ng spices and herbs to enhance the the flavor in the food. Okay, another one is taste food before salting it kasi nga baka tama na sa panlasa mo. Okay, before mo siya madagdagan para hindi natin masobrahan ng intake ng sodium. Okay, another one tips is leave the salt shaker in the cupboard para hindi ka maparang maano na ma-attempt na magdagdag ng asin. So yun yung mga tips natin to lower the sodium intake. Okay, note also that government advices says on average you should be eating no more than 6 grams of salt per day. Okay, so yun yung limit natin for the sodium intake. Okay, deficiency of sodium naman. Once na kulang ang intake mo ng sodium, okay, anong nangyari dyan? Hyponatremia. Okay, when we talk about hyponatremia, okay, mababa yung sodium level mo sa dugo. This occur in dehydration, okay, as in heat exhaustion after surgical procedure with marked loss of blood and vomiting and diarrhea. Long-term vigorous treatment restricted ang sodium intake. So, babagsak ang level mo ng sodium. Okay, ang mga symptoms dito is kapag ka hyponatremia, headache, confusion, loss of energy, drowsiness, inaantok ka, fatigue, mabilis kang mapagod, restlessness, irritability, muscle weakness, spasm or nagka-cramps, seizure, and coma. Yun yung mga mas severe na cause kapag hindi na-treat ang hyponatremia. Okay? So, another one is kapag excessive naman is hypernatremia. Okay, nangyayari pag hypernatremia, increase ang sodium level mo sa dugo, which may result to edema. Okay, magkakaroon ng manas. Okay, this usually occurs in a certain condition like in hypertension, yung mataas ang BP nila and yung mga may kidney stones. Okay? So, yun yung mga deficiency natin for sodium kapag ka-decrease and increase. Okay, last one or last two na lang sa ating major minerals. Okay, we have the chlorine. Okay, sa chlorine naman natin, ano ang function ng ating chlorine? Maintain the fluid and electrolyte balance and also the acid-base balance. It also contributes to the acidity necessary in the stomach or the HCl. Itong ating HCl or the hydrochloric acid, which plays an important role in the digestion and also in the immunity. So, ano yung mga sources naman natin for the chlorine? Okay, for the chlorine, we have the table salt. Okay, it has a NaCl or the sodium chloride. Okay, pag once na deficient ka naman ng chlorine, okay, alkalosis results when there is an excessive loss of chlorine ions or chloride ions from the gastric secretions during continued vomiting kapag laging nagsusuka, okay, diretsong nagsusuka and then nagtatae and also tube drainage. Okay, kapag ka nagde-drain sila. Anong nangyari dyan? Bumabagsak. Okay, alkalosis ang tawag doon. Okay, so yun yung ating deficiency ng chlorine. So last ng ating major mineral, we have the sulfur. Sa sulfur natin, ang function niya is this is to maintain the protein structure because of the disulfide linkages between the parallel peptide. Okay, this is also an active and it also activates the enzymes and participates in the detoxification reaction. Okay, pag sinabing natin detoxification reaction, it changes the toxic substance. Okay, anong ginagawa niya sa toxic substance? Ginagawa niya into a less toxic substance, which is easier yung katawan natin para mailabas yung toxic na yon. So, yun yung ginagawa ni ating detoxification reaction. Okay? So, yun. By which toxic materials conjugate with active sulfate and convert into non-toxic forms para mailabas natin through urine. So, yun yung ating function ng sulfur. We also have sources for sulfur. Okay? Protein contains about 1% sulfur, so that a diet adequate in protein will contain enough sulfur. Okay? Yung protein kasi natin, merong 1% doon. Okay, for the deficiency naman, a hereditary defect in tubular reabsorption of amino acid, cysteine may lead to excessive excretion in the urine causing cystinuria. When we talk about cystinuria, this is characterized by excessive amount of undissolved cysteine in the urine. Okay, however, repeated production of cysteine in the kidney may cause formation of the cystic kidney stones kapag paulit-ulit si cystinuria. Okay, pag sabi natin cystine kidney stone, this is caused by a rare disorder called the cystinuria. Ulitin natin, yung cystinuria is a characterized by excessive amount of undissolved cysteine in the urine. Okay? The disorder causes a natural substance called the cystine, which naglilik sa urine. So, when there is too much cysteine in the urine, kidney stone can be formed. Kaya nagkakaroon ng formation of cystine kidney stone. So, yun yung ating sulfur sa ating major minerals. So, next one is our trace minerals. In our trace minerals, they are required, diba, in a small amount kaysa sa ating mga major minerals. So, we have the iron. Okay, sa iron natin, this is an essential trace minerals. Okay? And itong iron natin is also yung mga functions nito. Okay, functions niya is necessary for the transport of oxygen via saan? Paano siya nakaka-transport ng oxygen? Via the hemoglobin in the red blood cells. Okay? And also in the oxygenations by cells via the cytochrome. Okay, ano naman yung two forms natin yung iron sa food? Meron tayong two forms of iron sa pagkain. We have the heme iron and then the non-heme iron. When we talk about heme iron sa mga animal products to, kapag non-heme iron sa mga plant sources naman siya. Okay, so sa heme iron comes from animal product and is found in meat, like sa mga chicken, beef, pork, and seafood, more efficiently absorbed in the body. So, mas na-absorb si heme iron natin, which is nakukuha natin sa mga animal products. Okay, si non-heme iron comes from plants. So, plant sources to. And it is found in dried beans, vegetables, tofu, dried fruits, and fortified cereals. Okay, eating meat with non-heme iron, okay, and vitamin C help with the absorption of the non-heme iron in the body. So, para ma-absorb natin si non-heme iron sa katawan natin, kailangan siyang may partner, okay? Para ma-absorb si non-heme iron, anong kailangan niya? Meat sources and the vitamin C. Okay, meat plus non-heme iron plus vitamin C, okay, para matulungan niya ma-absorb si non-heme iron na nakuha natin sa mga plant sources. So, yun yung ating two forms of iron sa mga pagkain, heme and then the non-heme iron. So, ano naman yung food sources natin? We have the fish, dried beans, meat, liver, poultry, eggs, green leafy vegetables, and cereals, okay? Especially those fortified with irons. Okay, ano naman ang recommended natin na dietary allowance of iron? According to the National Academy of Sciences, for women ages 19 to 50 is 18 milligrams per day, and for men naman age 19 pataas is 8 milligram per day. So, bakit kaya mas mataas ang babae kaysa sa lalaki? Okay? Mas mataas ang intake ng babae kasi nga, tayong women, okay, nawawalan tayo ng dugo. Kailan? Kapag ka nagme-mens, di ba? Monthly tayo nadadatnan. Aside from menstruation, sa pregnancy, okay, nagsusupplement ka ng hindi lang sa'yo, pati yung sa anak mo, okay? And even in lactation, okay? Kasi dalawa kayong kumukuha ng sapat na nutrient kailangan yung masupplementahan yung dalawa. Kaya mas malakas or mas madami ang needed for women kesa sa male pagdating sa iron natin. Okay? So, iron overload can damage the heart and liver, gonads. Okay, iron overload is particular risk in people who have a certain genetic condition which is the hemochromatosis. Okay, sometimes without knowing it, and also in people receiving current blood transfusion. Okay, iron supplements meant for adults such as pregnant women and also major cause of poisoning sa mga children. So for the hemochromatosis, di ba this is a certain genetic condition? At when we talk about hemochromatosis, it is a condition in which the body takes up and stores more iron than it needs. So mas nagtatago siya ng iron kesa yung kailangan mo or ginagamit mo. The extra iron is stored in the liver. Okay, saan pa niya tinatago? Sa heart, sa pancreas, which may cause liver disease, heart problem, and also organ failure, and also cancer. Okay, so another one, yun yung mga recommendations natin. Okay, for this one, for iron natin. So we also have tips in increasing your iron intake. Okay, include foods rich in vitamin C when planning meals kasi mas best absorb si iron natin pag may kasamang vitamin C. For example, nagtitake ka ng iron supplement, okay, or iron na gamot. Okay, ang the best na kasama niya is yung mga citrus juices, mga ganun. Okay, samahan mo ng vitamin C para mas ma-absorb. Okay, cook foods in iron pots and pans. Also include meat as a part of the meal. Iron from the meat is easily absorbed and also help your body absorb iron from plants. Okay, di ba yung non-heme iron natin tsaka heme iron? Okay, be aware, some things may hinder absorption. Pag sabing hinder, may mga bagay na nagde-delay or nag-obstruct sa absorption natin ng iron. Like excess amount of food such as caffeinated drinks, mahiling magkape, or high caffeine yung kinakain or iniinom, spinach, chocolate, fiber as well as antacid and calcium supplements may negatively affect the absorption ng ating iron. So, yun yung kailangan tandaan para mas ma-increase ang iron intake natin. Okay, for the contributing factor of poor iron intake naman, anong nangyari, bakit nagkakaroon ng poor iron intake? Okay, children who eat iron poor foods, okay? Replacing it by iron rich food para mas better yung ma-receive nilang iron intake. Yung mga batang who drinks, okay, children who drinks too much milk, okay, replacing it with iron rich foods also. Infants weaned to cow's milk before 1 year may have poor iron intake. Okay? And 'di ba ang ano natin kapag infant is dapat breast milk sila. Okay? Dapat 'yun lang ini-intake niya for the 6 months. Okay? Wala dapat pakain, walang cow's milk, dapat yung breastfeed lang. Okay? So women and teenage girls on calorie restricted diets may also have poor iron intake. Okay? So yun yung mga factors kung bakit mababa or mababa ang intake nila ng iron. Okay. For the result of the poor iron intake, okay. Kapag once na poor ang iron intake, ano yung mga pwedeng mangyari? Okay, it can contribute to iron deficiency anemia. When we talk about iron deficiency anemia, this is due to the insufficient intake of iron. Such, mga symptoms nito is feeling tired, pagod, madaling mapagod, and also shortness of breath. Okay? And also, it can cause irritation to stomach lining and also blood loss. Okay, once na low dietary iron intake and also increased iron loss through bleeding, ito yung nangyayari. Okay? It also hinders iron absorption from foods. Yan yung mga results kapag poor ang intake natin ng iron. Okay, aside from iron, which is a trace mineral, another one is iodine. Okay, for our iodine, iodine is a trace element and another nutrient that our body needs also to survive. Through it's one that is often difficult to get enough of through a regular diet. Okay, so iodine is added to a food that is nutritionists know we eat plenty of salt para masupplementan lang siya. Okay, anong function ng ating iodine? Okay, sa iodine natin, it's synthesis of thyroid hormone. Itong mga, pag sabi natin synthesis, di ba parang production or making. Okay, production of thyroid hormones. Yung thyroid hormones natin, okay, thyroid cells are the only cells in the body which can absorb the iodine. Okay, siya lang ang nakaka-absorb sa ating iodine. Okay, these cells combine iodine and amino acid tyrosine to make the T3 and the T4. Okay, which is the T3 is the triiodothyronine and T4 is the tetraiodothyronine. Okay, which influence large amount of metabolic function. So, yun yung ating function or important function ng ating iodine. Okay? So, ano yung mga food sources natin? Iodized salt is table salt with iodine added. It is the main food source of iodine. Another one is the seafoods. It is naturally rich in iodine. Like the cod. Itong cod is fish, sea bass, haddock, and perch are good sources of iodine. Kelp also, yung ating seaweed, yung mga brown seaweed, is the most common vegetable seafood that is rich in source of iodine. Another one is dairy products also contain iodine. And also other good sources are plant grown in iodine-rich soil. So, yun yung mga food sources natin for iodine. Okay, kapag deficiency ka naman or deficient ka ng iodine, anong nangyayari? Okay, ito na yung goiter. Okay, yung goiter natin, yun yung, ito. Wait lang, pakita ko. Ito yung ating, yan, goiter. Yung may, sa leeg, parang may mass dun sa leeg niya. Okay, so yan yung goiter natin. Enlargement or nag-enlarge or lumaki si thyroid gland. Okay? Ang cause nito, bakit kayo lumalaki sa ating thyroid gland? Because of iodine deficiency. Okay, once kasi na low ang iodine mo, okay, ang naproproduce niya is low thyroid hormone. Okay? And then, it produces more TSH. Okay, yung TSH natin is thyroid stimulating hormone. Anong ginagawa nito? It stimulates the thyroid to produce thyroid hormone and to grow in size. Okay, once na ang nadedetect niya kasi, diba, for example, kulang ang intake mo ng iodine. So, once na kulang, anong gagawin ng katawan mo? Okay, di magproproduce ng magproproduce. Okay, magtatrabaho si ating thyroid gland. Okay, once kasi na ginagamit, lumalaki yung size. Okay, bakit siya nag-work ng nag-work? Okay, para masupplementan yung low iodine intake mo. Kaya lumalaki si thyroid gland natin. Okay? Kaya na-stimulate si ating or nag-work si ating thyroid gland. Kaya lumalaki ang kanyang size. For example, kung for example nag-gym ka, 'di ba? Para lumaki yung muscle mo doon sa part, lagi mo siyang gamitin or pag gawin mo doon lang part. For example, nagba-barbell ka doon lang na for example sa mga biceps mo. Okay? Palagi kang nag-exercise or nagba-barbell. So, ano mangyari doon sa part ng muscle mo doon? Lalaki at lalaki siya. Okay? Ganun siya. Kapag workout ng workout, lumalaki yung specific na gland. Okay? Yan yung nangyari sa ating goiter. Okay? So, another one is the cretinism. This is a mental retardation. It occurs during pregnancy. Okay? Ang cretinism natin is untreated congenital hypothyroidism with or without goiter. Okay? Pag sinabi kasi nating mental retarded or mental retardation, ito yung permanent condition characterized by sub-average intelligence. Okay? Mental retarded. Ibig sabihin, hindi niya kasi ng IQ yung ka-age niya or yung age group niya. Okay? So, during this one also, ang nangyari kasi kapag during pregnancy, there is a congenital hypothyroidism or underactivity of the thyroid gland. Okay? So, yun yung ating cretinism. Okay, ano naman yung effect of iodine deficiency disorder? Okay, sa pregnancy. Ano nangyari sa pregnancy? Okay, spontaneous abortion pag once na mababa ang iodine mo, okay? Mababa ang iodine intake mo, mababa ang iodine mo sa katawan. So, once nabuntis ka, anong pwedeng mangyari? Spontaneous abortion. Okay, pag sinabi natin spontaneous abortion, okay, pregnancy loss at less than 20 weeks of gestational age. So, hindi pa niya naaabot yung age of viability, okay, na-abort or namatay yung baby, nalaglag, okay? So, yun yung sa spontaneous abortion. Stillbirth. Okay, stillbirth, ito yung death of a baby before or during the delivery. Ibig sabihin, before siya lumabas or before siya pinanganak, namatay na siya dati sa loob. Okay? Another one is maldevelop ang kanilang fetal brain. Okay? Cretinism. Yun yung sabi natin kanina na mental retarded. Yung IQ nila is permanent na to, permanent condition characterized by sub-average intelligence. Okay, aside from the pregnancy, we also have sa childhood. Okay, anong nakikita sa childhood? Yung goiter, okay, or the enlargement ng kanilang thyroid gland. Okay, mababa din ang kanilang IQ or the intelligence quotient and impaired ang kanilang learning. Okay, mental retardation, delayed ang kanilang motor development. Pag sinabi delayed is sobrang hindi niya kasabayan. Okay, so masyadong mabagal yung pag-develop niya. Okay, stunted growth. Okay, mabagal ang paglaki nila or hindi lumalaki. And apathy, ito yung lack of interest or concern. Muscular disorders also. And also paralysis, ito yung loss of the ability of the muscle or ability of the move. Ability to move some or all part of the body. Okay, loss of the ability. Hindi niya maigalaw, na paralyzed. Okay, speech and hearing defects also. High perinatal mortality, okay, when you become pregnant and up to a year after giving birth. Okay, high perinatal mortality. So, yung perinatal natin, yun yung when you become pregnant, okay, and up to a year after your giving birth. Okay, so another one is high infant mortality. When we talk about mortality, this is the number of death. Okay, another one, aside from pregnancy, childhood, we also have the adolescent. Sa adolescent naman natin, okay, mental retarded din sila and yung growth nila is retarded din aside from yung paglaki, even the development mentally. Okay, yun yung sa retardation kapag adolescent kapag yung deficient sila ng iodine. Okay, effect of iodine deficiency disorder. Okay, meron naman tayo sa adult and all ages. Okay, goiter. Yun yung ulit kanina. Irregular growth of the thyroid gland or enlargement. Hypothyroidism. Ito yung underactive yung kanilang thyroid gland. Okay, apathy. Yung lack of interest or concern. Impaired din ang kanilang mental function and reduce ang workload or work output. Okay, mas limit or kukunting nagagawa nilang trabaho. Okay, sa toxicity naman natin, okay, for the toxicity, yung ating goiter, yung sabi ko kanina, too much iodine. Anong nangyari naman pag too much iodine? It inhibit the thyroid hormone synthesis, which lead to less ang thyroid hormone. And then, once na less ang thyroid hormone, thyroid gland grows bigger. Okay? To supplement. Okay, so yun yung toxicity natin. So we also have the recommendations. The best way to get the daily recommendations of the essential vitamins is to eat a balanced diet that contains a variety of foods from the food guide plate, and most people are able to meet the daily recommendations by eating the seafood, iodized salt, plant grown in iodine-rich soils. So when buying salt, make sure it is labeled as iodized, okay? Para ma-supplementan mo din ito yung mga sources natin kasi for the iodine. Okay, the Food and Nutrition Board at the Institute of Medicine recommends the following dietary intake for iodine. So sa infant natin, we have the age of 0 to 6 months. Okay, ano ang recommendations nila? 110 micrograms per day. Okay, and for 7 to 12 months, 130 micrograms per day naman. So we also have sa children. Sa children natin is for 1 to 3 years old, 90 micrograms per day. 4 to 8 years old is 90 micrograms per day. 9 to 13 years old is 120 micrograms per day. So, for our adolescent and adult naman, ano ang recommendation nila or recommended intake for iodine is for male age 14 and older, 150 milligram per day, microgram per day. For female age 14 and older naman, 150 microgram per day. Pregnant females and all ages, mas mataas, 120 microgram per day. And lactating natin, yung mga nagpapa-breastfeed na mothers natin, of all ages, is 290 micrograms per day para ma-maintain yung adequate level for iodine to prevent yung mga iodine deficiency disorders. Okay? So, sa ating dalawa pa for ating trace mineral, we also have the zinc. Okay, yung zinc natin, it is also called an essential trace element because very small amount of zinc is necessary for human health. Okay, ano yung functions ng ating zinc naman? Okay, for their functions, okay, it plays a key role in maintaining the vision, okay, sa eyesight natin. Zinc might also have effect against the viruses. It appears to lessen the symptoms of the rhinovirus or yung virus for common cold. But researchers can't yet explain exactly how this work. Okay, kaya nga pag nagtitake kayo is vitamin C with zinc, mga ganon, ascorbic acid with zinc, ganon. And also, in addition, there is some evidence that zinc has some antiviral activity against the herpes virus. Ito yung ating herpes virus is a sexually transmitted disease. Either herpes virus 1 and 2, ito yung viral infections that causes the genital and oral herpes, which is very common and contagious. Ibig sabihin nakakahawa siya and wala po siyang cure sa ating herpes virus 1 and 2 or sexually transmitted disease. Okay, so for our sources naman for zinc, we have the red meat and poultry and sa mga fish sources natin. Okay, further deficiency naman, pag once na kulang ka ng zinc, okay, growth retardation, loss of appetite also and impaired ang kanilang immune function, alopecia or the hair loss, diarrhea, delayed ang kanilang sexual maturation, impotence, ito yung erectile dysfunction ng mga lalaki, and hypogonadism, which is sa mga males. Okay, this condition in which the body doesn't produce enough of the hormone that plays a key role in the masculine growth and development during the puberty or enough sperm or both. Okay, so yun yung sa effect niya sa mga males. Aside from that one is the eye and skin lesions. Okay, weight loss, delayed ang healing of wounds also, and taste abnormalities. And for the deficiency also of zinc is mental lethargy. Okay, ito yung sense of fatigue. Okay, yung parang pagod na pagod ka, lack of both mental and physical energy and motivation. That is the mental lethargy. Okay, sa last one natin for the trace mineral is the fluorine. Okay, yung fluorine natin is the most recognized or most essential trace element that is capable in inducing characteristic dental and bony changes when ingested in chronic excess. Okay, so sa fluorine din natin, this is the most recognized for its role in preventing and reversing dental caries, okay, pagkasira ng ngipin, and building strong teeth also and bones. Okay, they are stored in bones and teeth, yung ating fluorine. Okay, unabsorbed fluoride is excreted or nilalabas through urine kapag hindi na na-absorb. Okay, pag nasobrahan, hindi na na-absorb ng katawan, so saan siya pupunta? Naiihi lang natin or na-excrete na ilalabas through urination. So yung fluorosis natin is a term used to denote a chronic fluoride toxicity. Okay, so yun yung mga topic natin for the minerals, which is the major minerals and the trace minerals.